For Careers Week, I'm speaking to alumni from a range of different courses and a range of careers to talk about their career paths. And we'll be looking at topics like resilience, workplace wellbeing, and adapting to new ways of working. So today I'm speaking to alumna Jessica Brett, who graduated in nursing before studying healthcare practice at St George's. Her career spans nursing homes, NHS and private hospitals in intensive care and senior critical care outreach. She's also established various small businesses and a very successful nursing recruitment agency. Jessica was a finalist for Best Emerging Employer 2017 and Best Managing Director in 2018. So welcome today, Jessica, and thanks so much for speaking to me.
Thank you very much, Heather, for giving me a chance to, to talk to the alumni, and hopefully I could help in some ways to the student, to the graduates, to give them an insight of how you can achieve things, and it's not an easy, ways, but if you're passionate about it, you will get you will succeed in anything you wanted to do in life.
And could you start by telling us a bit about your role in your own career journey and maybe a bit about how your role's changed in the last year as well?
Yeah. My role um, spans from working initially in the nursing home, and transferring to the NHS, to the health services. I was always assigned in high dependency intensive care, and so to progress my role in that way. And then I'm one of the senior critical care outreach for the past for nearly 8 years, in fact. And and then I thought, I've done so many courses, that I've put myself into that profession. And at the end of it, I thought there's nothing for me. I've almost reached the nursing, profession. So um, I decided to build my own agency, recruitment agency, and now we are the fifth year with so much challenges. Um, but I thought, I am ready to take on a big role, the role that's not even clear to me because I did not have experience in the recruitment agency, and also how to build the nursing agency for myself. So yeah, so we are on the fifth year now. We are, you know, um, I'm building up the healthcare recruitment agency that I have. So recently we've been approved by the NHS procurement, so we will be supplying the NHS as well. So apart from the private hospitals and care homes that we have.
So it sounds like you've had a really interesting career and quite a busy career as well, and adapting to lots of changes and learning new things. Um, what has helped you strike a good work-life balance?
Um, to be honest, striking a good balance in what I'm doing now is not an easy job. It's all about your passion and your determination that you wanted to achieve something, and you actually help out as well at the same time, because it's not the recruitment agency or an agency healthcare company is not all about money, but it's also giving people the jobs like our healthcare workers, support workers, training them. Those people are homeless. We try to train them to be able to get a career in the healthcare profession. So striking a balance is, for me, what I'm doing now is very fulfilling as well, because I'm actually faced with so many people who hasn't got any jobs, and they come to us and we could help them. And then balancing about my life, I've got more, time for myself. I could bring my dog in the office, which I couldn't do in the hospital. So, it's really what you wanted to do and you wanted to achieve in life, but don't forget to also enjoy it.
Thank you. And you spoke a bit about how there was some resistance to your decision to move into nursing. How did you overcome this?
um Well, my family doesn't want to meet me to be a nurse, specifically because they wanted me to be, to be an accountant, because we have like family business that needed an accountant, person, and I'm good at maths. But it's not the career that I wanted to be, and I wanted to get out of the place where I am, and I already had a clear idea of what I wanted to do, and I wanted to be a nurse to go out and explore an adventure for myself.
And so in nursing, I imagine at the moment it's a very busy time and a time of quite high pressure. So is there anything that helps you stay positive during those challenging times?
Apart from, I'm not able to do hands-on nursing at the moment, and especially I used to be one of the, senior critical care outreach. I wanted to do volunteer. I wanted to do all sorts of things to get back there, but I also have a company that if I go out and help out, um, it almost like I'm risking myself and my company and helping the private hospital, the care homes, and all those stuff without me. So they basically, you just need to be, you know, vigilant and be positive about, your passion. I mean, it's not easy, but
Um,
I take pride of myself, yeah, for what I can help and do to people.
so you've said it's quite a challenging role in a lot of ways, but it sounds like you're really positive and really passionate about your role too. What do you think is the most rewarding thing about your career?
The most rewarding thing is I have my own time, and the work balance, that you can actually go into the office and no one is telling you what to do. It's very challenging because every problems and whatever you have, it goes or it comes back to you. So it's how you manage it, and also financially is very rewarding, and you have the options of, there's a lot of things.
Do you have any advice for someone who's looking to move into management like yourself?
Going into management is not an easy route, but if you are passionate about what you do and you have a clear idea of what you really wanted to achieve, you know, with your profession, it's not going to be an overnight success, but there is full of waves and challenges that you will encounter. That's a lot of failure. And I can see that in my, the fifth year of Smart Heart Professionals. We've been through a lot, and I thought in the third year I would like to give up, but I thought no, because I built this company, I will stand and keep this, because I knew that I'm helping a lot of people in terms of building their profession, giving them jobs. So helping the nursing homes and hospitals. So it's not all about money, it's that satisfaction that I get, and that really satisfied me.
That's great to hear a bit more about your own move into management. And it sounds like you've got a really successful recruitment agency. Like you say, it's a lot of work, but is there anything that's helped you run it smoothly and helped it be so successful?
Basically, it's preparation. I tried to open a company twice, so this is the third time. But on the third time, I said, I think I'm ready. I did 24 hours, 7 days a week, whatever I did, because I wanted it to be successful. And you know, it's not it's not going to be easy, but you really have to put your commitment, and you need to have guts, to tailor your success, because success is, it's not going to be given to you, or you just have to wait and you just say, oh, it's because of the fate, I didn't succeed on anything. But I think you will only succeed if you have actually, you know experience those failures, and those failures keep it as your preparatory and improve yourselves. And hopefully by then, because you learn from that experience, you become a better person and a better decision maker of what you really wanted to do.
And have you got any advice on any particular skills that are transferable from your degree at St George's that you could use in this kind of role?
Basically, the nursing, because I'm still, doing nursing as well at the same time, teaching the healthcare assistant, the carers, any sort of safeguarding. So it's very transferable. And I think if you equip yourself with um, every like the courses really helped me a lot, with in terms of management, the leadership. You need that to build your own success, because without those, it's not going to be an easy thing. And it's not like a one bullet you will succeed. So a lot of stuff that I did in George's, the nursing, um, the research, and all of those courses that I have, I'm sure it's a preparatory for where I am now.
Well, it's been so interesting hearing a bit more about your career journey. It sounds like you've achieved so much and you've learned so much from that experience. And I think it'll be really useful for students and new graduates thinking about their next steps if they're looking to move into a similar role. I think you've given them some really good career inspiration. So thanks again for joining us today.
Thank you very much, Heather, and thank you for this opportunity.
Thank you. Have a good day.
Thank you.